pen and chart. Early morning or midnight. Um, Namaskaram, Vinaka. How are you?
Hello, I'm good. I am going to be
Morning.
with Diego, but we're going to join together because we're using the same computer.
One computer to. Namaste.
Namaste. How everybody is there? Good.
Yes.
So you
And
are in
Michelle?
Bali still, right? I've been there.
Yeah.
It's a lovely place. So beautiful. You can hear me, right?
Yes.
Okay. Welcome, Vinaka. How are you?
Yes.
Priyanka?
Now, yes.
Yes, I'm good, thank you. How are you? You feeling better
Yeah,
day
little
by
cough.
day?
Yeah, only just cough giving me.
That's good.
How many joined? Okay. Okay. We're gonna wait for few more minutes for other students. Let's see they're
She
gonna
should be
join.
here soon.
Virginia,
Um,
Michelle is gonna join us.
yeah, she's going to join us. She just had to go run back her home. So 5 minutes, not even, because she already left. But one question was like, we have a lesson at 3. No,
No,
at
at 2:30.
2:30. Sorry.
Okay.
Wait, what time is
2:30.
it now?
Yeah, we have to leave at
Right now,
2:30.
No, at 3:30. We have a lesson at 4.
No, we have the lesson at 3:30. So we have to leave the class at 3:30.
Oh yeah, 3:30. I'm getting confused with times.
okay, what is the time
So
right
yeah,
now?
if it's
There?
good for you, like, because we have to end on
Could you tell me what is the right
oh,
now?
it's
What
not
is the time?
working.
What is the time right now there?
Magari si fa il video. In caso metto il mio telefono, ce l'ho qua.
Uh, Virginia, I'm asking what is the time right now there? You can hear me, right? Bianca, you got my notes?
Which notes? I wrote down
Sure.
notes from the
I
class.
Okay, we got the Wi-Fi.
I've shared to the management, the Soumya ji, the another faculty, and she gonna share on the WhatsApp.
Oh, okay.
I
No, not yet. I haven't checked it.
Nice.
I think she already shared. So are you added on the WhatsApp, Himalayan Yoga Association, or
Yeah, let me check now, actually.
so you can check. I shared the small video about the all the Sanskrit words I mentioned, whatever we did in the class. And today I'll share you more.
No, it's not
So
there. Did anybody else get it?
which group you are in? You can contact Soumya ji, right?
Sorry.
You have her number, Soumya. Hello, Virginia. You can hear me right now. Virginia, you can hear me?
Yes, I can hear you. I'm sorry. The Wi-Fi here doesn't work, and I always try to use it, but then I always end up using my 4G because it's unstable.
Mm-hmm. So use your 4G. So I'm asking, what is
Yeah,
the time right now there?
it's 2:40. So, oh yeah,
2:40.
because that's why you have 2:40. So we it's basically for the lesson we would have to finish like in an hour or so,
Okay,
and
we're gonna
that's when we have the other lesson.
yeah,
Yeah.
we're gonna finish within 1 hour. Don't worry.
Okay. Perfect.
Okay, so and so you are with Diego and Michelle, right? Michelle came.
Yeah.
Okay,
No,
so
Michelle. She's not here.
she's not here. So leave it. We're gonna start the session then. You can explain to her later on.
But she's supposed to enter with her own computer.
Okay, okay. No issue. So she's coming, no? She's gonna join.
She will join, but I think she's a bit late. I mean, I don't know what. I'll text her, but we can start and then I'll let her know.
Okay. Okay, okay, okay. That's fine. So we're gonna start. Bianca, you can hear me, right? So I'm gonna start uh, from now. Yesterday we discussed about the three dosha, how it's related to the environment, and so write it down. The another thing, it's related to the day and night also. Like we talked about the season, we talked about how it's related to the digestion, and we talked about how the other things are related, like age. So day and night also is related to the three dosha. Daily, like the whole day, is also related to the three dosha. So early morning, I think early morning time before sunrise, that is a time is a kapha. That time we practice Shat Karma. I think all of you are practicing the Shat Karma. You heard about it, this Shat Karma.
Yes.
Okay, good. So early morning is the ideal time to practice the Shat Karma, because Shat Karma is basically working on the balancing the three dosha. So many Hatha yogis, they practice the Shat Karma before the sunrise, ideal time, because that is the time when you uh, control your kapha. Kapha element is increased during the early morning time. So that time is ideal for practicing the Shat Karma. That's why we do Jal Neti, Sutra Neti, or Rubber Neti, and other practice, because it's working reducing your kapha element, balancing your kapha and also the pitta. But early morning is the kapha time. You can write it down day and then write it down. More early morning time is a kapha time. Okay. Then later on noon time, midday, when sun is on the top, that is the time of the pitta. I'll tell you how it's very much important, because according to the kapha, pitta, and vat, we have the diet. So when we're gonna talk about the diet, then you're gonna relate these things. So midday, noon time is the time of pitta. When pitta heat is outside during the daytime and heat is inside your body, it's increased, it's affecting your body. Mostly, I think most of the country during the daytime when sun is rises, there is a heat, little bit, maybe less or more. That depend according to the climate, according to the environment, but there is a heat comparison to the early morning. I think that makes sense. Then we come to the evening time. Evening time is mostly the dry time. This time is what is aggravated in the environment. So day evening time, during this time there is a lots of wind blow. You can see mostly evening time or early or late night. There is a wind blowing most of the time, dry wind blowing. That's because of the vat in the environment. Vat, it's prevalent in the that time. That's why wind blow during most of the time, wind blow during that time. So vat is evening, noon is pith, and more morning, early morning time is a kapha time. Okay. So this is the day division. Then night division, you can again write it down night, and then write it down early night. Early night, like around 8 to 10 or something. There's no fixed timing because it depends how when the sun rises, when the sun go down. It depends on that. So we cannot fix the timing there. But after the sunset completely, after the sunset of the 1 or 2 hour, maybe 1.5 hour, there is a night start, and that night we called, that is the time of the kapha. That time is the kapha time. There is a little bit cold in the environment. After the evening, you see night is very much cold. That is a time when kapha is prevalent in the night. So early night, around 8 to 9 or 10, maybe depend, that 2 or 3 hours is the kapha time. Then we have midnight. Midnight is the time when we talked about pith. Pith, again, environment is changing, night is also changing. So first kapha, then pith, midnight. During the midnight, there is a pith, then around 11 to 12, and then we have late night, 1 to 2 or 3 around. There is a time, again we have kaf, sorry, vat. Then we have vat. So early night you have kaf, then midnight pit, then late night, you can write it down like that. Late night, that is the vat. And then again cycle start, the day start, and then again kaf, pitta, vat. This is the cycle of the day and night. I think this much is clear for everyone till now. Any doubt? Night, day and night. And
Yeah, no, that's good.
okay, very good. Now from that, we're gonna talk about, we discuss about the agni, and today we're gonna discuss about, I think nobody's have any problem related to the agni, right? Now we're gonna talk about today. You can write it down. Mal, three mala, TRI3 mala, MAALA, mala, mala, TRI3 mala,
The chat.
MAALA, three mala.
And,
This three mala is what? Basically, three means three, mala means waste. So
I
three
have a
types.
question.
Yeah, yeah, Diego.
In the Pita, Kappa, Evita, when we, because this is the different times of, so it means that you need, that is better if you eat on that period of time. So it's like you are eating twice a day, or you can like what is the best? Because of course we have like a breakfast, lunch, and dinner. But if
Uh-huh.
you,
We
it's
come to
better
that.
for you.
We come to that. Don't worry, Diego. Wait,
Okay,
have
okay.
patience. We're gonna cover that thing also. It's coming to the Mitahar. When we're gonna discuss about it, we go everything. Then you have the clear understanding about how everything according to the dosha, we're going to have the meal, and according to the position of the sun. Depend person to
Okay.
person, climate, we have to consider so many factors here. Okay.
Okay.
So the question which you're asking, it required many lectures. Okay. So don't worry, have patience, we're going to cover that thing. Okay. But this is clear to you now, night and day,
Yes.
age, season. Okay. Very good. Lovely.
And what was the spelling again of mala?
Spelling of
The what we're talking about now,
Timala.
Timala.
Trimala. Trimala.
Okay, thank you.
Okay. So three means three. Mala means waste. WASTE, waste. So body is secreting the waste. Understand, once your three dosha is imbalanced, your Agni is imbalanced, your waste, like system is taking out the waste from the body. So there's a more than 100 types of the waste coming out from your body. According to the Buddhist culture, they mention more than the 100 types of the waste coming from your body. But Ayurveda talks about the most three important waste which affected by when person is having any disease, any problem, any disorder. Their waste would be affected. Understand, the three malas, most important three mala is your poo, your pee, your sweat. So poo we call poo, stool, right? Then pee, your urine, and sweating, you sweat. Your sweat is also come into the waste category. So body is secreting these, taking out the waste from the these things. How these gonna affect it? Understand, once you get mental disorder, psychosomatic disorder like IBS, I think, have you heard about IBS? Irritable bowel syndrome. This is a psychosomatic problem. In this, person get either the diarrhea, they frequently going to the poo, or they get constipated. In both way, their waste is affected. Problem is where? Problem is here, in the mind. That is a psychosomatic problem, means mind is disturbed. They're having certain problems, and because of the stress, because of the anxiety, their waste, secreting the waste from the body is affected. Either they're going frequently or either they constipated. So even the people who are having anger issue, heat issue, so they sweat a lot. Their sweating is affected. Either they sweat a lot or there is no sweating. Both is creating the problem in the body. You have to sweat when you are doing the practice, yes, but too much smelly sweat, it's again showing the sign that there is a problem in your body. So body basically give the symptoms, show the symptoms through the pee and through the poo. Even color of the poo, when you are on the antibiotic, for example, you get infection or something, and you are in the antibiotic, your poo color would be gonna change. Your urine color would be gonna change, and it become yellowish and little bit smelly. Your sweat, I think if you are aware about it, your sweat smell keep on changing, especially in the female. During the menstruation time, the smell of the sweat is completely changed, and their cycle, a whole month, they have many types of the smell. So those who are paying attention towards their body, they can easily figure out what's happened to their body. So Ayurveda, Swami Vagbharji said that if people start paying attention towards their body signal, they become the doctor. They can treat 80% of the problem. They can treat 80% of the body problem, mental problem by themselves. They don't need to seek the doctor at all. If you figure out, you pay attention, you listen the body always give the sign through your malas. Your mala gonna be changed if you have any problems in the body, but you have to be more conscious about it. Many doctor, especially Ayurvedic doctor, when you go and take the help of the doctor, they check their three malas. They're gonna ask how's your poo, how's the color. They're gonna ask these things. How's your urine? Even there is a one biggest hospital, Tibetan hospital. I think, have you heard about Tibetan medicine? They are also giving the treatment on the basis of the herbs. So how they check the patient? They check the urine of the patient, and through the checking the urine of the patient, they curing the cancer, tuberculosis, other arthritis. So they diagnose the problem by just checking the urine of the patient. Even in African culture, I don't know, are you familiar of? There is a study. They check the diabetic they check the diabetic, the sugar level through the checking the urine of the patient. So very simple. You don't require blood test or so many things. If you just pay attention in towards your waste system, how's the color, how's your smell, how's your sweating, you're too much sweating or less sweating, smell, then you can figure out the problems by yourself. So three mala is very much important. These three mala and ancient, through the ancient doctor to till now, today modern doctor, they are utilizing these technique to diagnose the disease in the patient. So these are the effective method. And I think many doctors, allopathic doctor, they are treating you on the symptom basis medicine they are giving you. Even COVID-19, whatever the symptoms is coming to you, accordingly you have to take the medicine. There is no cure. There is no perfect medicine for this disease. Asthma, there is no perfect disease, no perfect medicine. Cancer, not a, there is no, you know, a pill that you can have it and you can cure from the cancer, tuberculosis. No, not at all. Symptom basis they are treating you. So if the treatment is based on the symptom basis, there is no medicine. So you can believe on your immune system. You can check yourself. You can see your poo, your pee, your sweat daily in the daily routine, and then you can figure out by yourself. Because if you're going to the doctor, doctor gonna do same thing. So same thing I'm doing on myself during this whole time. I'm checking daily myself, like how I'm improving and how's my symptom is going on and how's my poo, pee and everything is affected. So if you learn this technique, you just have to be very attentive to it. So three mala is very helpful if you understand this concept. From today now, you can start observing your poo and pee and your sweat. So pay attention. I know it's a little bit yucky. It's very yucky. But again, the waste, it is your body, dear. Inside your body, there's a, everything is so yucky. Believe me, it's not beautiful things are coming out. But yes, that is the reality, that is the truth. You have to see yourself inside what is going on. So check yourself daily and see it's gonna change or it's remain same. This is a homework. It's a one kind of homework for you guys. For today itself, check your poo and pee your sweat and make the note whole month, especially females. Check your smell. It's gonna change or not. So, and even the diet play important role. What kind of diet you are having it, accordingly your smell's gonna change. Your color of the poo and pee gonna change. So it's affecting you. I think this much is clear for the three mala. And further write it down. Amma. A A-M-A, ama. So, ama, A-M-A, ama. Further, Swami Vagbharji explain about ama, how it's affected. What is ama? Sorry, pardon. Ama is nothing but toxin. Ama is a toxin of the body. How it's generate? Understand? It's linked. Your three dosha is imbalanced. Now, you get certain kind of disease. For example, you get kapha imbalance. Now, because of kapha, you have throat infection, sinus problem, any kind of cold. These symptoms are there. Now, once you got this problem, what happened? Your Agni, your Agni would be affected. So, Kapha Agni, which are type of Agni they are having it? Manda Agni. Kapha imbalance. So, what type of Agni they are having? Manda Agni. Man means slow digestion. So, whatever they're gonna have the food properly not digested. Food remain in the small intestine or the stomach, and it's stuck there. Food is not absorbed by the body. Now, what happened? Now, Agni is imbalanced. So, your mala would be imbalanced. Properly, you're not cleaning out the system. You're not going for poo. You constipated. You feel constipation. Now, poo is not coming out. Your urine would be changed, smelly, become smelly, or a little bit there's a discoloration happen. So now what happened? The food is inside your body and waste is not properly coming out. Now the amma start accumulating in your body, because whenever you leave something, something is inside your body which is not absorbed, which is not taken out, it's remain in your body, then it started rotting inside your body. When start rotting inside the body, it means there is a toxin, there certain kind of gases are released and it's become poisonous. So your inside your body there is a poison secreted, that called amma. And when this amma reach to your joints, it called arthritis. So amma vata problem you later on understand. Then you get arthritis, osteoporosis. When amma mix in the blood, you get hypertension. It's create the clotting. So toxin mix with discharge. The toxin is like started developing in, for example, in your small intestine. Now it's gonna travel in entire your body. So where it's gonna reach, it's give you the problem. It's reach towards the joints, your synovial joints, like knee joint, elbow joint, neck joint. So you feel the stiffness, pain, swelling, inflammation. If it reaches to the blood, it's give you thrombosis, clotting in the blood. Then it reaches to the brain, stroke, or some other mental disorder come to you. So this toxin, how this toxin is developing, because three dosha imbalance, your agni is imbalanced, then your mala is not properly coming out, and then you start having ama in the body. Ama is accumulated, there is no way out to take it out. So this ama is a poisonous which body is creating, body is secreting. How you can prevent? For that, we have Shat Karma. We have more than 32 types of Shat Karma. Hatha yogis, Asian yogis, they practice the Shat Karma before practicing asan. Why? So your body is capable of taking out this ama, this toxin of the body through the Shat Karma practice. I think right now you are learning 1 and 2, but there is a whole branch of the Shatkarma, um, very deeper level of the Shatkarma. I think if you get the chance, I think there is a very less few schools which teaching the actual Shatkarma. If there is any traditional school, go and learn the Shatkarma. Is most important practice to work on balancing the three dosha and taking out the ama. In Ayurveda, it called Panchakarma. In Hatha Yoga, it called Shatkarma. So it's more similar. In Hatha Yogis, they do Shatkarma by themselves. They do Panchakarma by themselves. In Hatha Yogis, they do Shatkarma by themselves. Hello.
Hello?
Penso que
Yeah,
está late.
you can hear me right now, right?
Yes,
Yeah.
I can hear you now.
Okay. So I think we talked about it. Nothing is missed, right? So if you learn this practice Shatkarma, there is a 32 types of the Shatkarma. If you learn all of the Shatkarma, is amazing thing. You can cleanse your body by yourself. Or rather, go enroll yourself in the Panchakarma therapy. Go for the Ayurvedic uh, center and take the Panchakarma therapy before practicing the yoga, actual yoga. So body become, you have to remove the toxin from your body first. This is the very first step before practicing the asan. This is the step by step practice of the yoga. Now, so this is linked. I think your mala and your ama is linked together. This much is clear for everyone. Virginia, Bianca, Diego, and Michelle joined or not?
Yeah, I'm here.
Yeah, Michelle. So clear to everyone. This still here?
Yes,
Yes,
very
all is
clear.
good.
Okay, lovely, lovely. So now further write it down the next topic, that is urges. Vague, we call vague. Vague, the spelling of the vague, V E G H A. Vague.
Big.
Hmm. VEGHA. Vague. So what is a vague? Sorry, pardon. Understand, the vague means urges. Urges. So you have the urges. Certain urges in your body is coming out. So write it down one by one. There's more than 13 types of the urges. So first urge, you're sneezing, like sneezing, then yawning, right? Sneezing, yawning, sleeping, sneezing, yawning, sleeping, burping. Like this, we do know burping. So burping, belching, that also called belching, right? So burping or belching. Then coughing, you cough. When there is a cough, you have to take it out. Do not. And then vomiting. If you have urge of vomit, yes, you have to puke. Then sleeping. If you have feeling sleeping, you have to sleep. You cannot avoid that, oh, I have to awake. No, that time you have to sleep. Body required rest. Then sleeping, then further you have to like holding the poo. Some people, they hold their poo in the stool. They have the urge for going to the poo, but they are holding it. No, never ever do these things. And peeing, especially females. Females, most of the time, I don't know, this is because of the social pressure or something, they hold their bladder. It's the most dangerous things they are doing to themselves. Never ever hold poo and pee. You have to go if you feel like the urge many times, because we female get most of the time fungus infection, bacterial infection, vagina infection, urine infection, so many things. I know there's so many things. So we get urine infection, so we have to go back to back pee, right? We have the urge. So you have to go. Don't stop. Every time, whenever you feel having the urge, go. No matter how many times you are going it, you have to go. Don't get just okay. People gonna what the other people, your friends and your family gonna think about it. Not at all. Think about yourself. So poo, pee, and fart. This is again most important thing. I don't know how these things started happening in the wrong way. Social pressure, peer pressure. People are afraid of farting in public. That is the most worst thing they are doing to themselves. I don't know who started this thing. I think maybe it started in the Britain or something. They are more polished and civilized people, I think. So they have started, maybe. I don't know. But you have to fart openly. Females, please fart openly. If you have urge farting, farting urge, you have to fart. Don't stop. Because if you stop your fart, it may can give you fatal disease because you're stopping the gases, the bad gases which secreting from the anal region. And if you're stopping it, maybe you get fatal disease. You're gonna disturb your apan vayu, the vat, and then you're gonna disturb your agni, and then you disturb your tridosha, and many diseases come to you. Those who stop farting, those who afraid of farting, no matter whenever you want to fart, just go in little bit corner and fart. Don't afraid, be free. This is my what do you say, saying that openly fart, openly go for poo. This is the natural cause. Never ever stop. Then another, sexual urges. Never ever stop your ejaculation. Men, it is for especially for the men. Never ever stop your ejaculation. Like urge when I don't know. I think because of the wrong understanding of the Tantra Yoga. I think have you heard about it? This word Tantra Yoga. There is a one part where the yogis, those who are practicing the Tantra, they're holding their semen. You shouldn't be doing it. According to the Ayurveda, according to the uh, yog, yogic text, the people shouldn't be stop their ejaculation because you have to take it out. If you're stopping it, you may be losing your ojas, your aura, your energy, the vital force, the life. You are making your lifespans short rather being the long. there is a way, there is a way to increase the time. But if you have urge and that urge you're gonna stop, it's create the problem in the body. Don't misunderstood that I'm disagree with the brahmacharya. No, brahmacharya play important role. But here we are talking about the urges. If you have urges, then you have to go through it. Your sexual desire, if you have sexual needs, that very moment you have to fulfill that thing. Then hunger and thirst. Never ever hold your hunger and your thirst. Okay, if you're thirsty, you have to drink the water. If you are hungry, you have to have the food. Do not take the panga with the hunger and thirst. Yes, yes, Virginia.
I have a
Question.
question.
Hmm.
Because what is for how long? I know that you said like we can't hold the things, right? The natural calls and everything, but
Yeah.
sometimes it depends where are you. You cannot go to the toilet to do some poo, or you cannot go to like for the girls they cannot pee on the street. Some guys you can go to the tree and you can do it, but in that case for how long you can wait, is like it's a minimum or is a maximum time about it?
No, 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 no. Believe me, dear, I did this thing and good question. But if I share my experience, I go in the tree. I go into the jungle. I don't care about it. Once I get the urge, I'm not thinking about the social pressure. I'm not thinking about anything. That's why I'm saying you have to be free mentally because there's a social pressure. There's a social pressure, especially for the female, that you shouldn't be going openly. uh, yeah, first you have to see the toilets, like there is every washroom and nearby. But if you don't get it, don't suppress your urge. Immediately you have to go. There's no question that you have to think about the other people, what they're gonna see me or they're gonna talk about me or whatever. No, you have to be free, mentally free, without any peer pressure, without any social pressure, without any what your friends, your boyfriend, your girlfriend gonna think about it. Believe me, keep this keep this thing aside. Most important thing is your health. If you are healthy, you get everything. If you're not healthy, sick person does not have any relationship, does not have anything, nobody gonna bother about it. You have to take the stand for this thing right now. It's a great movement, I think. I think it's the biggest movement in this social, I think, social conduct. Yes, take little bit scenario, okay, go into the little bit corner and somewhere, and then you have to release it. But yes, you cannot stop. I think my answer is very much clear. That's why I'm keep telling, come out from the social pressure. Yeah, especially females. I come out,
And is
believe
that the
me.
same?
It's like I don't care about it. Yeah.
Of course, but is it the same menstruation? Is it one of these? Is it part of these urges?
Exactly. Hunger,
The
thirst,
urges, is
your
menstruation
sexual.
one of them?
Yes, menstruation is
Okay.
also no, 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 no. Menstruation is automatically happening, right? It's not the urge. You cannot stop the menstruation.
Okay. Yeah,
But
it's not
yes,
an urge.
people,
Yeah.
yes, but people who are taking the medicine for stopping the menstruation, there's a many girls who start taking the pills that they do. Meanwhile, they are traveling or something. That is a very bad thing they are doing. They shouldn't be taking the eye pill or other pills even for the abortion and other things. These are the very harmful things. And some rings are there's a hormonal therapy, right, for treating the menstruation pain and other things, is very most dangerous things they are doing to themselves. I meet across the world many students. They coming to me for therapy, yoga session, yoga therapy, and we discuss about it, and I figure out they are doing very very bad thing to themselves. They're taking the pills, they're taking the other things. um, it's very dangerous, so don't do those things. Rather than doing those things, have the little bit strong determination, strong willpower, power, and work on your that okay, the planning, that where you have to go indulge into the sexual relationship or not. keep thinking about it, because right now the scenario is totally changed. Now you are touching, you are sharing the many bacteria, virus. So if you are having the any relationship with anyone, imagine how many things you are gonna exchange. So be loyal to your partner. I think and world is teaching you. Bacteria and virus is teaching you, be loyal to your partner. So you're not spreading the virus and the bacteria to across the world. Now human being degraded very down right now. So I think we need to learn from the bacteria and virus that we have to be pure. We have to learn how to be loyal to your partner, how to be loyal to your family, rather being having multiple relationship. Be stick to the one. So there's many diseases you can prevent. So have little bit control over yourself. This is most important things. We need it really. Today we need it because many relationship you get many problems, many diseases. Not physical level, but psychological level, mental level, and your another level. There's a spiritual level also affected. That you're gonna understand later on when you're practicing the yoga. Then you're gonna observe your body more deeply, and you're gonna see once you form a relationship with the another person, how it's gonna affect you, how your energy gonna change. You're gonna see these things. But I have seen it. This is my personal experience. So that's why I'm very strong. I have very strong belief. So believe in yourself and be loyal. Be loyal. This is most important thing to prevent many diseases. I think this much is clear to everyone. So till now, any doubt in the urges?
No, it's clear.
It's clear.
That's good.
Michelle,
Yes.
Vinica, Diego.
Mm-hmm.
Okay,
Yes.
lovely. Any doubt
Everything
here?
okay? Everything clear and sound.
Oh, lovely, lovely.
Virginia,
Okay, so from now we're gonna end our session, and if you have any doubt, you can write it down. Even later on, if you get any question, you can ask in the next session. So don't worry about it. Keep asking the question so I can go deeper and deeper. And but yes, it should be related to the today's session. Don't jump to the other session, because I'm gonna cover all the things, and then you get the clarity how these yoga therapy and Ayurveda is connected, and how we can help ourselves to heal ourselves. So
can I
till now,
ask you a question?
yeah, definitely, yeah, yes.
Yeah, because now you yesterday you said that you got COVID because your doshas was unbalanced, right? Why
Yeah.
do you think that make you, because now is 1 year and a half, already almost 2 years that we has been with this pandemic. So what
Mm.
make you go like to not get balance at this moment with your doshas? What is the thing? Because yeah, because you are, I think that very much into the Ayurvedic thing. So what is the thing that makes
Uh,
you stress your mind?
okay. So good question, dear Diego. The one thing first, we are not yogi. Okay, we are not yogi. Abhi, right now, I'm not reached to the avikrit state. First thing. Second, if I reach to the avikrit state, I become yogi. Then I have to be stable on that position. It doesn't mean if I'm yogi, I cannot fall into the sick. Yogi also fall into the sickness. Yogi also get the disease. Lord Buddha, Lord Rama, Lord Krishna, Lord Shiva, they get the disease and then cure it. They believe on their immune system. They believe on their body, like how I'm treating. I'm not taking the pills. I'm believing on my immune system. I'm taking the Ayurvedic medicine and helping myself. I'm doing Shatkarma, practicing breathing. So I'm fighting with the second waves of the COVID. Understand this thing. As I told you, outside environment is also affecting your inside environment. So outside, if COVID, the virus is going on, it's gonna imbalance your body three dosha, right? That we discuss about it. So right now, the outside environment, the climate is completely unfavorable. It's creating the more kapha, and because of the virus, it go inside my system and it creating more kapha. And then how I get sickness. But my healing capacity, like I'm not. I got fever, but I'm healing very quickly. I am observing myself comparison to the people like I'm in Delhi. You can't believe in Delhi there's a what kind of situation is going on. People are dying, hospitals are full, and people are, they are crying for the oxygen cylinder, and we cannot buy the oxygen cylinder also. Everything is so chaos here. In that situation, I'm doing very well. If you are looking from my point of view, I'm not going into that level critical condition. My healing process is faster than the comparison to the other people because I'm working on myself. But understand, yogi people also get sick, but their healing power is very fast. They quickly heal, they come out. And imagine how the ayurveda come into the existence. People fall into the sickness. That's how they figure out. No, they figure out, okay, this medicine gonna work, okay, this thing's gonna work. That's how the yogi do research. I'm doing research, but I'm not actual true yogi right now. I cannot say myself there's a long way to be a yogi, but right now I'm doing research. I'm figuring out that how I can treat myself through the yoga therapy. If I'm not falling into the sickness, how I gonna cure? How I can find out the cure in the yoga therapy, where everybody is looking for the treatment, right? So sickness is not bad. Understand, sickness is not bad. First, take it out this concept from your mind that sickness, diseases are the bad. No, it's good. It's tell you that something is going wrong in your body, correct it and be healthy. Okay, so, and if not, figure out what the method to correct it. If Asian people they don't have the disease, the Ayurveda wouldn't be there, the yoga therapy wouldn't be existed, right? They got disease and now we're getting the benefit out of it. I think answer is very much clear to the Diego.
Yes, thank you very much. Very, very clear. And thank you very much for your honesty. And it's really very motivate to keep learning. Yes, because it's like we are, we were saying like the body is a machine, but the brain is like another machine that is working as well. And that is control a lot of things. So, but thank you very
Exactly.
much for your answer. And it's very clear. Thank you very much.
Welcome, dear. So now we're gonna end our session here. Namaskaram, Mangal ho, bless you, dear. Be happy, be healthy. Enjoy.
Thank you.
Thank
Thank
you.
Bye
Thank
bye.
you.
Bye.
Thank
Bye
you.
bye.
See you
See you.
tomorrow. Bye.
See you tomorrow.